The hour, and it's time now for our latest edition of What's Going Around. Joining us this morning, Dr. David Maccabee, bariatric and general surgeon, and also Carrie Smith, a bariatric nurse coordinator, both from Marion Regional Medical Center. And we're talking this morning about the American Medical Association's recent decision to officially recognize obesity as a disease and also bariatric surgery options. So good morning to the both of you.
Good morning.
Good morning.
All right, so we'll start off with Dr. Maccabee. Let's talk about the AMA's new classification of obesity as a disease. What exactly does that mean, and how important is it?
I think it's very important for the recognition of this problem, which I think most people in the country at this point seem to understand, but it guarantees a lot more attention will be paid to the disease state and to patients, and really most importantly that funding for patients to get treatment is going to be much more widely available, and that is going to be part of the whole national healthcare scheme that I think we're going to start feeling as that comes into effect. The understanding that obesity is not a problem of willpower, it's not just someone's fault that they made some bad choices and didn't take care of it, but that indeed it is a disease which people don't have full control over, and that it's a multifactorial problem that is part of, it's partly genetic, partly familial, partly choices, and partly our society all coming together. And that obesity disease process is something that greatly impacts our society and individuals as well.
Yeah, definitely. And for Carrie, in your experience, I mean, what does the classification mean for people here on the Central Coast, and what can they do about that?
Well, on the Central Coast here, what's nice is our Weight Loss Surgery Institute of the Central Coast serves our local community, and they don't have to travel far to seek weight loss surgery as a tool for weight loss. Our program began pretty much a year ago, and you've been doing surgery since January, and he's done hundreds of surgeries, but here he's done almost 30 by the end of the week. So we've applied for accreditation, and hopefully that will come about soon. Yeah,
and Dr. Maccabee, talk about that bariatric surgery and those options. What can you tell us?
The Weight Loss Surgery Institute, which is a partnership between myself and Dignity Hospitals, all the hospitals in the region, we offer 3 operations. The gastric bypass is the most common and sort of popular of the operations that we do. Sleeve gastrectomy is an increasingly commonly used option, and the lap band is the 3rd operation that most people come seeking. And most patients lose the majority of their extra body weight and see most of their medical problems either go away or radically improve. So high blood pressure, sleep apnea, depression, irregular periods or polycystic ovary disease, and most importantly diabetes all get better with significant weight loss, and all of those operations offer that.
Yeah, very important, obviously. And Carrie, there's some seminars coming up locally that if people are interested in getting some information to make some important decisions in their life, what would they need to know about those?
Well, routinely we have at least 1 seminar a month, sometimes 2. Santa Maria, and then at French Hospital. French Hospital, August 29th is our next seminar, and that'll be in the auditorium at French Medical Center.
Okay, French Hospital there in San Luis Obispo. And like you mentioned, Doctor, real quick, I mean, this is something very important. People fighting obesity, like you mentioned, it's very important to get that under control, because the quality of life that you could have if it is corrected, it changes significantly and improves the quality. And in fact, most importantly, here's a look at the staff here.
So
it creates a longer life, is really and a better quality of life.
Both of those things are true. It extends the life that people live, usually by up to decades, and the years that you are alive are typically much more active, satisfying, and healthy. I mean, you can look at it from a lot of different ways, but the operations pay for themselves in 2 to 5 years, because the number of medications that people take goes down drastically as your diabetes gets better and your high blood pressure gets better and your sleep apnea improves and you don't need the mask anymore. And I wish, I'd like to come back with some patients like before and after.
Definitely.
But what we see is a radical change in people. They come in We meet them, we spend a number of months working them up, we do their surgery, and a year later we don't even recognize them. We see them in the grocery store and they're like, hey, it's Dr. Mack, you know.
I know those.
Who are you?
Yeah, those must be the success stories that you love to see.
And that's the common outcome, not for everyone, but for the vast majority of people, the outcomes are very good.
Okay, so there are definitely options out there for you. Dr. David Maccabee and Carrie Smith with Marion Regional Medical Center. Thanks for
having
talking
us.
with us today.